Yeah, so welcome to D-Life channel. A big welcome to all the viewers. And today we have a special guest from Finland, Dr. Antti Heikkilä, who is an orthopedic surgeon. And before this, a short introduction about D-Life. So D-Life is a forum of obesity and diabetes suffering individuals, those who have metabolic syndrome. And this is a place where they can actually come and share their success stories. And D-Life has more than 250 success stories and more than 1,200 recipes which are of low carb and oriented towards India. Now, a couple of caveats here. First of all, declaration that there are no financial dealings in any of the things. Everything is free of cost, absolutely. And I'm one of the active volunteers, and also I'm a premium member who is a lifetime member there. And I'm doing this as one of the services so that the world knows about, and India especially knows about low carb nutrition in general. So welcome, Dr. Antti.
Thank you.
So Dr. Antti, first I'll just introduce.
Great pleasure to be in contact with India.
So Dr. Antti, just give me a few minutes. I'll just read out your introduction for the viewers so they should know your background. So Dr. Antti Heikkilä is an orthopedic surgeon from Finland and currently practicing in Germany also. And he would prefer to call himself Finland's leading dissident in medicine and nutrition. Dr. Heikkilä is an orthopedic surgeon who has changed his practice after reading compelling research on the benefits of low carb, high healthy fat diet to treat and prevent chronic disease. And Dr. Antti has also begun using lchf and ketogenic diet in his practice for more than 20 years. So that's a huge time. And most of the other doctors and people like us, we are actually sitting on your shoulder, doctor.
Okay, thank you. Thank you.
2 decades, vast experience. And with all this, he says, it is difficult to unsee robust scientific evidence that is staring right in front of your eyes. More so when you see it dramatically improving obesity and diabetes patients' life. And as this, along with others, Dr. Antti's patients have been able to lose vast amount of weight quickly and safely. They have been able to manage to reverse their diabetes symptom and check off all the drugs in the nearest dustbin. And Dr. Heikkilä has also written a number of books on low carb nutrition, which also includes books like Nutrition Therapy for Diabetes in 2008, Diabetes Remission Through Nutrition, and A Life Without Drugs. So Dr. Antti Heikkilä, welcome once again to India in a virtual form.
So thank you. I'm pleased to be with you. This is so challenging and new for me, this technology and everything. I normally sit at home and so on. Do I tell about me?
Yeah, please do tell us about yourself.
Yeah. It's a quite long history because in end of the 1960s, I was in the States as a medical student, not hanging around, not studying anything, but I met the one psychiatric there in New York, who treated his patients with the nutrition and psychotherapy. And it was a very challenging, and we became friends. And then I got ideas about Dr. Atkins ideas and all that stuff. And it has been since then my idea in the background that it's big opportunities with the nutrition to treat people. And those days they have a kind of movement in the America with this nutrition and psychiatric treatment. They found out, for example, that grains, that gluten can provoke the psychosis or even schizophrenia and all that stuff. And it was very interesting. And since then, I've been having doubts about the mainstream media, and that's why I became a surgeon, an orthopedic surgeon, because I felt it's a honest work. I can help people directly, because in the hospitals they give 1 pill today and 2 pills tomorrow, and half of it, it was not a science itself. So it's gradually I started to study the subject, and I realized that the patients my method is to listen to patients. That I ask them that what makes you worse, what makes you better, and so on. I give them the space to tell their experience about themselves, and that's how I found out that it's a food is the make key issue about. They said that I ate that, I got pains and I got headache and so on, and that was a thing. It was then I read a German, no, he's Austrian doctor's books about it. It name was Leben ohne Brot. That means that living without the bread. And his name was Wolfgang Lutz, and he died recently, about 100 years old.
Life without bread. That is the book.
Without life without the bread, yes. Because he was a long time physician and was very ill when he was 40s. And he was thinking, in Germany, there's a tradition about the natural treatments, and he was thinking about the diet. And then he discovered this Eskimo diet, and he fully recovered and so on. And he wrote about the issues, and he got tremendous good results about treating the digestion problems and pains and whatsoever with this low carb diet.
You meant Dr. Wilhelmer Stephenson.
Yeah, and then they made studies in Hanover University. And this one professor was Jürgen Scholle and that Wolfgang Lutz, and they make studies about the hormonal balances. And they found out that the whole system is based on hormonal balance. It's like a scale. And another end is anabolic hormone, another end is catabolic. So if some hormones comes up, they have to reduce to some other hormones and so on. For example, this is a fully automatic system, but you can manipulate the system by food. You can, if you eat a lot of sugar, the insulin comes up. And if you, another end, it's cortisol. You can have a stress and, the cortisol comes up and it gets unbalanced system. So, for example, if we have high insulin level, the first what the body makes, it lowers the growth hormone or testosterone. Or in other end, it increases the cortisol. So it's a very damaging system if you have high insulin. And that's the simple thing, is reduce the insulin and it's automatically balance itself. For example, if you have a high insulin patients, they normally have osteoporosis and all kinds of systems because the anabolic system is mixed up. And the cortisol level is a little bit difficult because the chronic stress is very difficult to treat in our society, but it's good to know. And that's my base of thinking, that anabolic and catabolic. And when I listen to patients, I start to think what is the problem really? Is it in the catabolic side or in anabolic side? So it makes sense, and it works very fine, and that's why it's the leading issue about myself, and if we come in the basic of the insulin, it's very dangerous hormone, and if you get a little bit more about insulin, your body starts to resist it, and it comes as a vicious circle that if the information of the insulin doesn't go through, you know, they put the more insulin. And so insulin itself, it creates, it's dangerous, it makes cancer, it damages the arteries and so on. And that's the insulin resistance is the key issue nowadays in society. It's a base of all these modern type of diseases, even the mental diseases. And that's how I wrote my book, you know, Living Without Medication. And that makes the Finnish society furious. I got attacked with it all. 2 years they had to, it was a difficult time. But anyhow, it's there was an Italian researcher. He is also MD, and Francesco Facchini, and he made a study about this insulin resistance. And he had 3 different groups. One group is totally healthy and insulin was balanced. And the second has a little bit higher insulin level. And the third was the real insulin resistance. And he followed these patients about 6 years and found out at the end of the study, the first group who has no problems with the insulin, they was completely healthy. But the second group was a little bit high insulin. They first got high blood pressure, and secondly, they got cancer, a little bit heart disease. So, and the third group, then they have the diabetes and cancer, and they have strokes and heart attacks and whatsoever. So we are dealing with these people who are belongs in the third group with medication. And if you can treat the insulin resistance, so the whole problem will disappear. That's the simple. And that's how I stepped to systems toes, you know. They didn't like it because the whole structure of the modern medicine is based on the chemicals, and you are not the individual, you are a target where you are to implement this kind of system. But it's, I think it's in India, and it's very important, you know, there's a lot of poor people, and that's why it's, you know, it's easy to treat it if you think about the insulin resistance. I read also one Indian study. Yeah, that's, I have to tell about the Norwegian study, which was made a few years ago. They just cut off the sugar, refined carbs, and industrial seed oils. What happened? Whatever they ate, everybody was healthy. And I think it's sugar and industrial seeds are very dangerous. And that was many years ago with a study which has made in India. You know, there's a lot of areas.
Malhotra Indian Railway Study, SL Malhotra Indian Railway Study.
Yeah, but you know, there's areas where they eat meat and everything and use butter as food making and so on. And there is a strictly vegetarian people, but they use these seed oils, and they have more heart attacks in that vegetarian population than the normal food. So it's interesting to think.
This study was compared. They have compared the Indian Railway workers of northern and southern part, and northern part actually had more grains and calorically more food, but however the fat was primarily dairy fat, high amount of dairy fat, whereas from southern part on a high carb diet, but on a lower caloric intake compared to northern part. However, they were using a lot of seed oils like peanut oil, sesame oil, and the myocardial infarction was higher in the southern part compared to northern. So this is a very interesting epidemiological study, which is highly respected in the world over. I mean, all low carb doctors, they know much about this Malhotra railway study.
Yeah, but it's easy to do it because you have a big population doing the same thing. So it's easy to follow up. Yeah.
So Doc, please tell us, which are the various kind of patients you are treated with low carb nutrition, whether it is obesity or diabetes, or are there other like hypertension or even mental illnesses?
Yeah.
What is your span of experience?
It's I trust the people. If you give advice, they can do it by themselves, especially in these issues. I only tell it's what's all about. And if you make changes in your life, that's the simple. And that's a very long story. I was operating people, and then I've discovered this back surgery is shit. If I can say, it makes more damage than good. Then I created own method to manipulate and everything, and so I did it that. But I am now in April I'm going to be 75 years old. So I'm semi-retired, and I have built up one health club in Finland where we have customers, and I treat these people and give ideas what they can do, and they ask me by internet. That's the one thing. And I write books, not lately, but I mean I give the information for the people so they can do it. But I don't know. This is a challenging to speak with you in India. It's a new perspective, but the one thing I want to tell is about the eating, and eating habits has disturbed the metabolism totally. It's continuous to eating and so on. You have to have meal times, but in America, they are speaking now about the fasting and all that stupid thing. In the Europe, for example, it's very old tradition, and in the mornings, people don't eat hardly nothing, or take coffee, and they have a lunch and they have a late dinner. So it's based on hormonal balance. When you eat, your insulin comes up, and when that has handled, then comes the glucagon, which is the opposite, and start to release energy from the storage. And it's a kind of rhythm. But if you eat all the time snacks and something, the glucagon doesn't work. That's why you are coming fat. That's the very simple thing. You don't have to have fantastic name of fasting. You have just dinner and meal times, and everybody. And that's the one thing. It's the fast food industry has destroyed the health in Asia also. These people must be shot with these fast food systems.
So Doc, coming back to the question again, which are the different kind of patients have you treated? Have you found low carb nutrition to be useful in patients with diabetes, obesity, and even hypertension? And how about those who are mentally ill? Does this low carb nutrition provide benefit to them also?
Yeah, it's a whole range of the diseases and symptoms, and you cannot even imagine how effective it is. And it's many of these, for example, the mental diseases, depression, bipolar system, and even psychosis, they react very well. And I've had patients with very severe mental illnesses, and they have recovered totally with ketogenic diet or whatever you call it, but reducing the carbs. I don't know how it works, but maybe it's a kind of disturbance in the hormonal side on brain metabolism also. And keto stuff is better fuel for the brains also. I don't know. And very interesting phenomena I have heard about my patients. talking about the alcohol consumption, it's very sensitive area, but many have said that you know, they don't drink anymore. They were quite heavy drinkers and they stop it totally. When once I remember I had a very big guy, like a truck driver or something, and he came to me and said, "Your book is good, but strangely, the booze doesn't taste anymore for me." I said, "That's a good thing." And I asked, how much you usually drink a day? 3 bottles of red wine, and that's the minimum. I was surprised so much. And it totally cut the consumption of the alcohol. And I think it's speaking about, for example, the alcohol, it is something to do with the sugar, you know. It is very typical for alcoholic that they are cravings for sugar and sweet things. And, you know, it's that's the fun. The secondary is, you know, all these problems with the intentions and guts and this inflammation in colon and colon colitis and so on. They can treat it with this simple method. And what they do, they give a horrible medication in normal way, and if that doesn't help, they just remove the guts away, and it's horrible. And that was the first discovery for example, the Wolfgang Lutz. He has written that he has cured 10,000 morbus Crohn patient with this simple diet. Bread without the bread.
Life without bread.
Oh, that's gluten is very dangerous for me. I got the symptoms from the grains, and that's the first discovery that when I left the bread, these all symptoms disappeared.
So how many patients, approximate number of patients you have treated over this 20 years with this kind of nutrition? What would be the approximate?
During these years, you know, I'm a little bit bohem in that side. You know, I don't keep a statistic, but I have calculated at least that 30,000 or
wow,
yeah,
30,000 is just massive.
Yeah, about like that and more. And there is a lot of more which has read my book. I have never seen that, but I receive feedback from emails and so on. I don't know. There must be 10 times more than like that, and even that. And wherever Finland is quite small. People like me. I'm a kind of a local hero. It's only 5 million people, and the land is like UK together. It's a lot of space, but they come to me and said, "I read your book, and that's okay. I found it in the library," and you know, it's the free information for the people. So it's, I mean, that's the good idea in India. What you are doing to the same and give the information like that, and so it's not the rocket science, and it's a simple thing. And so on, you know. But you know,
we do find, yes,
avoiding this fast food and the factory-made food in general, grow your own food. That's very important.
And the experience in our DLife forum, we find that, you know, this particular nutrition, they provide a lot of relief for obesity, diabetes, polycystic ovarian disease, even osteoarthritis, and even hypertension. You know, there have been a lot of incidences where people are able to come off multiple pills, multiple blood pressure pills, just off within a few months. So, wide range of application. We also have cases of psychosis also. Yeah, mental illnesses, people getting off all the drugs simply by, you know, by low carb nutrition. And of late, there have been a lot of research coming on. There are a lot of research papers which shows that insulin resistance is a big component in all the mental illnesses. and with a possible B12 deficiency. So probably if we identify these two components, insulin resistance and B12, has been implicated quite heavily in almost all of the mental illnesses, almost all.
Yeah, that's a big problem.
And
vitamin. How about
it?
The vitamin D in Indian people?
See, this is surprising. I mean, this is surprising, and maybe you will also laugh. This country has a lot of sunshine, but most of us actually have vitamin D deficiency below that mandatory 30 nanogram per ml. Most of them will be roaming around with just maybe 10 or so. Most of them.
Yeah,
sun avoidance, huge sun avoidance, and people may be using the sunscreen lotions, and maybe a lot of other factors, lot of sedentary jobs, indoor jobs.
So
that factor does exist.
Yeah.
So, Doc, one more question we are a little curious to know, because you have 2 decades of experience. How is this? Is this sustainable? Do you have cases of patients who are continuing this lifestyle for a long number of time, maybe 10 years, 15 years? Do you have such cases?
Yeah, totally. I always speak about lifestyle change, and that's important. That's I point out. It's like a pregnancy. You cannot be a little pregnant. You either or not.
Yeah, that's true.
That's I tell them. And it's most of the people when they started this low carb, it's they feel so good mentally, and that's why less stressed and they are relaxed and so on. It's real. It changed everything in a way, and it's one guy came and said that it's strange. He was so madman in the traffic. He was, passing everybody. I want to, drive like a madman. But when he adopted this diet, he's like a Buddha, going slowly and doesn't matter. And that's many people say that they after this that change, they can think clearly and they can feel clearly, but they don't mix these two together. So it's they can watch themselves and I'm mad. So what? They don't, express them freely to other people, and so it's many ways. It's interesting. So I'm very optimistic, but especially in West, the media don't write anything about this. They just continues to say, the grains are healthy, the industrial cereals, they are healthy. I mean, that's a crime for humanity, and that's the way. And that's why it's for example, in Finland, it's created a new movement, underground movements. People are, started to think at what the heck they are telling to us. Is the other things are all sort of wrong as the politics in the whole and so on. I think it's the biggest problem in the West is now it's corruption. Everything is connected, and I hope it's going to be a big change. I hope people get tired.
So, Doc, how is we read that, while you're from Finland, you primarily now practice mostly in Germany. So, how is this, the medical establishment in Finland? I heard that, they don't like you or for this nutrition-based treatment.
In Finland,
don't mind talking about it.
In Finland, it's very close society, they speak only Finnish, and it's very corrupted. I mean, in that sense that the big companies rule the whole system. It was better, but it's still like that. It's became worse than no. And they openly in the media, they expel that the alternative medicine is dangerous and so on. And they don't criticize whatever, so scientific methods are creating so much problem. But in Germany, they have a long history of it. That's why I moved here. And the second reason I moved here, because I love the classical music, so German classical music. And it's more civilized than Finland. And they have a long history about the natural treatment. And the general practitioners, they have a specialty for alternative therapies, homeopathy, acupuncture, some give even Indian, that's Ayurveda, and so on. It's openly accepted, and no one criticized that, and so on. It's even though in Germany is a very strong chemical industry.
Yeah. I think it has a very good history of pharmaceuticals before the World War. They were one of the pioneers in pharmaceuticals.
Yeah, that's the beginning of this big pharma in Germany. So that's, but I mean, that means that there is a deeper culture here, and that's why I'm enjoying to be here. It's more relaxed. In Finland,
sir.
In Finland, either or, it's black and white, because the culture is so thin, And I think it's the same in India, that you have a very deep culture, You can't go on the streets and say that this is the truth. They say, go away. But anyhow, what I'm doing, I'm a great fan of Mahatma Gandhi, and I always say my patients that vote with your feet and do yourself, and that's what we have to do. And I think that's going to happen in the West too. And they have a passive resistance to everything, and they choose differently. But okay, the great majority is still sleeping and so on.
I think, but doctors like you, you're doing a great service with so many decades of experience. Doc, we would like to know, have you noticed any shortcomings or any adverse effect of following low carb? Is it short term, long term?
No, nothing.
Fine.
Only some people don't just dare to go with because.
So for the benefit of the viewers, how is it that is it risky to have a higher fat diet? Is it risky to have a little more protein than which is had, because of the common scare that protein damages kidney, fats will cause heart disease? So what is your experience in this?
That's nonsense, and the low carb make kidney function better, and it's the fats that's the completely artificial theory. It's insulin and sugar which makes the people. It was a professor in London. It was 70s. He wrote a book, White and Dangerous, and John
Yudkin.
Yeah, and they wanted to kill him.
Pure white, deadly.
Yeah, and I think that's the key point, because it's a big business, that the sugar is the key issue about all this food they make, and these industrial made fats. That's a funny, for example, they tell people here that, in the past, when war was over, the young men died in the heart attack because of the animal fats. But it's nonsense. Nobody had animal fats. They used the margarine because it's a lack of all kind of food in the whole Europe. They ate, poor people, margarine from the beginning of the war and long after the war. And secondly, they didn't realize that how damaging is the war itself for the people's minds and body and so on. It's nonsense, you know. It's unhuman, and it's based on corruption, you know. That's it. But anyhow, it's the most natural way to eat. Poor food without any chemicals and sugar especially, because the sugar is something which is added in a human history. And I know there's a lot of sweets, but it's more honey in India than the poor sugar. Yeah. But
India is one of the largest producers of sugar.
oh,
We are one
yeah, I
of the
know
largest
that nowadays, but that's my recommendation. If you put all this info together, that's my recommendation to all low carb, whatever you have, because some studies says that about 75% of the population is risky to get diabetes or this hormonal imbalances. I don't know. I think it's 100%, but we don't know for sure, because it's very difficult to study how the people really eat or not to eat. And you know, the healthy eating is kind of sentence which is inflated. So it has many meanings. Yeah. So it's, I don't know how it's possible to implement in India that low carb.
I think we are doing it, Doc. So low carb movement is gaining traction in India, and
Yeah.
folks like D-Life, you know, we are at the forefront of pushing this option to all the people who will require. And if you really see, almost all, I will say that almost all of us are insulin resistance, and unfortunately, it is something like, you know, we don't measure insulin at all, so we never know until we become diabetic. I know that is the final stage. And at the stage of insulin resistance, we never measure insulin. So how is it in your practice? Do you measure insulin?
But it's, I mean, it's India. It's a long history with the food. It's tradition, and I mean, it's keep that tradition go on. And I think that's the solution. I think it's in India the problems became with the Western food.
Yeah,
Not the Indian
food.
True,
that is true.
Yeah.
So I will say that in modern times, it is not only, you know, it is not only the Western food, but, you know, some of the traditional Indian foods itself could be toxic, because they use refined flour and they use reused oil, and especially the snack makers, and then they add sugar. So it is something, you know, you see, in India, it was generally a country of famine earlier. So food was scarce and we never used to eat so much. So, you know, we have something called a thrifty gene. We are not used to this overnutrition which we have. And, you know, suddenly now we are eating, snacking every 1 hour. So that is going to be a problem. So,
but it's insulin resistance. It's an interesting thing that it doesn't make everybody fat. You can be thin, but resistant to insulin. So you have to find out what it's all about.
But then in our country, we are all primarily lean people. We are all tofu.
Yeah.
Thin outside, fat inside. Our personal threshold is very low, and we may appear lean, but we can be severely insulin resistant.
Yeah. But you know, it's all around the world, we are humans, the same race. So
that is true.
And the body reacts the same way. So it's, but the solutions are local ones, but according to traditions, you can't push the people eat the same food all around the world. What they have been taught this fast food industry that everybody can eat it is shit, you know. I've always said that that's a modern version of the imperialism to put this fast food around the world, and so I don't know. So what the India must do is get rid of these fast food businesses around there and create their own system that and traditional eating, that you have to have lunch or dinner, not to eating all the time. That's the simple thing. And they have good results around it. And it's got the sugar and got the industrial seed oil. But that's a big question for the poor people, at how they can manage it without these oils. But coconut oil, I don't know how expensive that in India, but that's a healthy one. I mean, preparing the food also, cooking the food, coconut oil.
You see, no doubt this coconut oil will be, slightly more costly than the refined oil because they prepare it in tons. So refined oil would be definitely cheaper compared to coconut oil, no doubt. So that issue would be there, because all the modern processed food are damn cheap. So they are so cheap that people can buy it. Even poor can buy it and snack every day. So that issue is going to be there. But however, as you said earlier, that people used to skip breakfast, have lunch, dinner. So even if you have two meal, two low carb, high fat meal, so that itself would be will be solving a lot of issue. So do you have any experience with Indian vegetarians? Have you treated Indian vegetarians in this 20 years? How is your experience?
Yeah, it's one thing. It's interesting also in London. That's Azam Malhotra is, but he don't speak about the ketogenic diet. He speaks about. He wrote a book of Pioppi diet. It's a village in Italy, but it's based on the traditional local food, and that's the thing. Yeah. And the same phenomenon happened. And I mean, I was thinking about this in India, especially how come you can have a cheap oil, which is healthy. I mean, that's the very important thing. I mean, it's in the larger scale. But I mean, in India, it's very important to spread the word and tell this is the healthy alternative and make it.
So that's what we are doing, Doc. That's why we invited personalities like you, doctors like you, who have been this, low carb nutrition for the last 2 decades, so that pass on the message. So, Doc, yeah, you'd like to say something?
I wanted to only say that my experience about spreading the word is good, because you have to think about what to say to people, tell them about their problems, that there is another solution. And whenever you do it, that's the way to do it. Not like it, I tell you to do it. Okay, you can.
Yeah. So any message to India? Would you like to say? Any final message to India you would like to say?
You'd make a great work there.
Pardon?
You make a great work down there. So we are kind of missionaries in that sense, which your international idea about food.
So, Doc, what I'll do is I'll just let the participants unmute, so so they can ask any question if they want. So the forum is now open for any question. So unmute and ask.
Yes, I can read it here also.
Yeah. I mean, they can also unmute and read, unmute, and there's no issue.
Yeah, that's a very interesting. The first question is it possible to come out to type 2 diabetes without medication? That is really, really important question, and that's how the low carb works. All my patients can live without the medication. It's simple and it works fine, and that's the goal to do it. And that's the important. And
I think something about some sugar. I think Anjali has addressed that. Yeah, from Vijay.
Yeah.
In Germany. I have one question, doctor. Hello?
Hello, yes.
Yeah, am I audible?
Yeah.
Yeah.
All right. So I have this question around red meat, right? While if you look at a lot of the Western community, they talk quite a bit about steak, bacon, and a lot of red meat intake. But when you look at another side of studies, many other studies also say it's best to limit red meat because that could also cause a lot of heart problems. So, what is it that what has been your take and observation over the past few years?
Look, I have got a lot of experience of patients who had adopted this carnivore diet, and they have done very well. And it's all the studies. I don't even call them studies. What claim that red meat is dangerous is nonsense. It's absolutely nonsense. There is no proof for that. And I've seen in my clinical work and practice and studies, the real reason to blame the red meat is about this globalist movement that everybody must go to vegan diet and for the climate, which is also nonsense. You know, it's no debate about it and so on. But the real reason is money. When they make artificial meat, they make a lot of profit. If you make a good organic meat, you don't make a good money about it. It's really like that. Industry wants to make everything by themselves. And that's why we have to resist the idea and eat local produced food and forget that shit, you know. Sorry if I use it. I get angry about these things. For example, in Finland, we have these Sami people, which we call Finnish Indians or in Lapland, and they eat a lot of meat or primarily meat, and they have less all kind of illnesses what the major population in Finland. They are very healthy people and hardly no heart attacks and so on, and so it's you know, it's, I think it's the major media, mainstream media, it's manipulating people's mind. It's nothing to do with the science and nothing to do with the real life and something like that. And that's why I find it's very important also in India, cut out of these nonsense and stay into locally. So.
Thank you, Anjali. That was a good question.
Yeah, more in the Indian context, we don't really depend on bacon or pork or beef, but red meat more comes from lamb or mutton. So basically what you're saying is it's all right for people to actually have it on a regular basis and it wouldn't cause any problems at all.
Yeah, that's okay, yes. And I think it's, pork is okay, but nowadays it's not so good meat anymore because they feed it wrongly. For example, pork fat has too much omega-6 fats, so it's not good. All animals what we are eating must be free range, and muttons are like that. And I think it's one of the best meat. It's lamb and mutton.
Awesome. Thank you so much, doctor.
Yeah.
Thanks, Anjali. So anyone else has any question they want to ask?
See, a lot of, this is Arvind Kori.
Yeah, Arvind.
In the treatment of this mental illnesses, the drugs which have been used, they have very adverse side effects with limited outcome. So can this LCHF be used to replace that, and the patient can be treated much better, and the outcome would be healthy lifestyle for these mental health group people, either it is depression or Alzheimer's or schizophrenia?
Yeah, there is one psychiatric, American psychiatrist, Palmer name that you can find.
Georgie Eade,
Yeah, yeah.
Chris Palmer. There are two.
Yeah, and he has quite long experience about treating people with the low carb. I mean, mental patients with the low carb, but because I am not a psychiatric, but I have had these mental patients quite a lot. I don't know, spread. People tell about me around the society until he's a little bit crazy guy and makes a kind of different kind of solution and problems. And all these patients has done very well with the diet, but they have to stay in strict. But what I have been seeing that mentally patients feel so good after this diet that they don't change their lifestyle habit at all. That is a good motivation. Get rid of, for example, fantasies and so on. Yeah. There's a lot
So
of.
Arvind, in D-Life Forum, we do have a few cases where people are knocked off 4 to 5 or even 6 medication just by adopting a low carb diet. And
Yes, it's not the problem itself, the medication, but we have experienced in North Finland, in mental hospital in North Finland, that they call it open dialogue. Whenever the people get the acute situation with mental disease, they treat him or her with discussion only, but very intensive discussion, and they have got very good results in the Finland. You can see it in YouTube. They have programs, open dialogue in Finland, open dialogue in mental issues. That is gives you another perspective, which is non-medical and non-nutrition thing, but it's very interesting. So that's my answer for that. Sorry that I have a little
there's
bit.
a question here. A person asks, how can we test insulin resistance? So Chetan, we need to measure insulin, fasting insulin, and fasting blood sugar, and with both we can actually calculate the insulin resistance status. Yeah. Later on, Chetan, since we are in touch. So any more questions? Anyone wants to ask anything?
Hello. Yes. Can I ask a question, please, Shashikant?
Yes.
Okay. I've been on this low carb, high fat diet for about 11 months now. And it feels really good to have lost over 25 kilos in weight. What I'm finding is that I'm still continuing to lose fat. I mean, to lose weight around my body, you know. Is this going to continue to happen until I come off the low carb, high fat diet? Or is there going to be a point where, you know, my body says, okay, enough fat has been lost, don't need to lose any more fat now?
Yeah, it's you look marvelous. Is that your picture?
Thank you.
And you know, it's for example, it's this diet makes it very good for women. You know, it makes the face look shiny. I can see on the street that woman is on the low carb. But what I have been seeing that the body knows where to stop, and you can go on. It doesn't go forever thinner, but you reach your own balance. There is a people who are a little bit overweight and they are balanced by the hormonal side, and that's okay, and they go on. It's not fat losing diet. It's a kind of manipulation of the hormonal side. It's a hormonal problem. And this overweight is a secondary system. If you start to, and it's very important to eat so much that you can. It's nothing to dieting. It's a kind of changing the whole metabolism.
Yes, I'm not actually trying to diet. I got to a point where I wanted to lower my insulin and come off the diabetic drugs that I was on. I was also on insulin, and that has happened. I find that at times when my stress levels go up a little bit, my cortisol goes up, and that then increases my insulin level, my blood sugar level. And as soon as I calm down, the cortisol levels come down, and then I'm okay again. But I haven't got to the point where I've actually had to go back on insulin. So I'm very happy about that.
And it's very dangerous to take it. Do you have a diabetes type 2 or?
Yes, type 2.
Yeah, never use insulin. That's very dangerous in that combination, because forget the insulin. It's not so dangerous that if your blood sugar floats in a little bit, in the time it goes really slowly down, and you can live it without medication. And it's one thing that some people get a little bit higher blood sugar in the mornings, but that's a physiological phenomenon, because before you wake up, your cortisol comes up, because it's a kind of stimulation to get rid of the bed, and that causes a little bit spikes in the blood sugar, but that's not dangerous. That's a physiological phenomenon. If you measure the blood sugar after 1 hour, you have been waking up, that's normalized. And just, I have to say that my patients many times that don't measure so often. Feel it. You can feel it. If you feel good, that's okay.
Yes, I think you're very right. I was a maniac about testing my blood sugar in the morning and worrying like hell if it was above 99, and then doing it again in the evening, and then doing it again before I went to bed, and I've stopped doing that now because
stop it. Stop it.
Yeah, because it was making me really crazy about measuring everything,
That's it's okay. Now I have been reading in the newspapers that they are creating a kind of intelligent watch which measures the blood sugar through the skin. I don't know if it's that. I don't use any measurements. I tried this keto sticks or something like that. I use them twice, and then the whole tool is somewhere in the drawer or something like that. Be free, I can see your face that you are balanced.
Thank you.
Yeah.
No, I feel really good. But it's just, I was just worried that almost every week I'm beginning to feel that, my muscles are beginning to appear again after so many years. Otherwise, they were covered with this huge layer of fat, I mean, I've decreased in almost 2.5, 3 dress sizes, and I just got scared that, this is going to continue to happen, and am I going to be kind of wasting, but thank you for confirming that is not the case. That's really good.
But you can also practice a high intensity interval training. And that's very effective. That's very effective, and it's don't have to. It's the whole idea to do these exercises in 15 minutes, not longer. It stimulates your growth hormone and it lowers your insulin, and it's very effective. Only 2 times a week. I'm a very lazy guy. I am doing it all the time, 2 times in a week, only 15 minutes. It's not the idea to make a big physical programs, and it creates your growth hormone, and that builds up your muscles.
Okay.
Yeah.
Doctor, I was actually scared to do any exercise because I thought, I'm eating as much as I possibly can, as much as my appetite is allowing. And if I'm already continuing to decrease in size, then if I do any exercise, that's going to make me decrease even more. But okay, so activating the growth hormone is a very good idea. Very good idea.
Yeah.
Okay.
Try it.
Okay, 15 minutes. Yes.
Okay, 15 minutes only. Short intervals,
Yes, 15. 1-5 or 5-0?
1-5, yeah. 1-5.
1-5. Okay. Fantastic. The other question that I had, very quick question, was that ever since I've been decreasing in weight, I've also found that my lips are getting very dry, and also the membranes on the inside of my nose, my nostrils, they're getting very thin. Is there something I can do about that?
The good remedy for that is vitamin A nasal spray.
Okay, thank you. Vitamin A nasal spray.
Yeah.
Shashikant.
Yeah.
Okay.
One question, Shashikant, for the doctor.
Okay.
Thank you very much, sir, for your discourse. I have been on LCHF for the last 4 years. I feel there is some loss of muscle.
Okay, you need more protein. That's the very
I need more
important.
protein.
Yeah.
That's what Shashikant keeps telling me all the time, that I need more protein.
Yeah, you need an animal protein. I mean, it's meat, fish, and they are good choices. Okay,
you can easily have. Bhaskar is a meat eater, so you can easily have.
I'm a meat eater. I eat about 150 to 250 grams of meat every day. Is that too less?
Yeah, I think it's too less. And if you have possibility to take the whey protein.
Yeah, I can take 1 scoop of whey every day.
Yeah, you can increase it 2 scoops.
Okay. Okay.
I mean, you need a little bit more
protein. Okay.
That's
I'm 5 feet 10 inches tall and I weigh about 73 kilos.
Okay, that's fine.
Okay, Shashi, thank you.
Thanks.
Okay.
Any more questions from viewers? Any more questions? So I think that's about it.
Thank you so much, doctor.
Thanks. Anup Singh, you would like to say something? Anup Singh?
There's
all okay.
Anup?
The only thing that I would like for Sneh is, as doctor suggested, you do 15-minute short interval HIIT. I would also add to that whatever exercise you do for resistance training, do it when you are fasting. Right, doctor?
Yeah. I didn't hear clearly. It's a question about the fasting. What to do with?
It is a question about exercise from Sneha.
Yeah, you can do it. Yeah.
HIIT, fasting state. Fasting.
Yeah. And it's
basically
everything goes rhythm. And for example, this high intensity interval training is very, very effective because it's in rhythm. You go slowly and then fast I do it with bicycling, this machine. And first I start with slowly 1 minute and then very fast 30 seconds. And then I keep a break until 3 minutes and then repeat that fast period. And in 15 minutes, you can do it 7 times these fast movements. And so fast you can do it. The whole thing, it balances the hormone system, increases the good hormones. And also it's a very, very effective to heart. The most of the people die in the heart attack, it's not because of the, the clot in the arteries. It's because the muscle function is good, not so good. And it must be flexible. The heart rhythm, when it's not flexible, it's very dangerous, because it doesn't react properly when you have to do it something fast. With these exercises, you can make your heart rhythm flexible. And that's another thing. It's a quite long and broad issue, but anyhow, anyhow, the people who are running marathon and making a long distance running and all that shit, it's very dangerous, because when they are coming into in the finish line, they have measured their blood, and they have found out their blood chemicals are the same after the heart disease, heart attack. Yeah, that's
raised troponin levels.
Yeah, that's the thing.
Yeah, I think that's about it. Okay, for Sneha, one question she had is for vegetarians. Yeah, Sneha, for vegetarians, yeah, it is the dairy which is important. It is the cheese, it is the paneer, it is the hung curd, and it is the whey. So these are the primary source of protein for vegetarians. Yeah, I think that's about it. And yeah, so I will end the recording now. So first of all, Dr. Antti, thank you very much for coming in and sharing your experience in this forum. Really thankful to you that you could share your 20 years of experience and offer a guidance to all of us. So thank you. Thanks, Doctor. Thank you, and Dr. Antti.
Okay.
Thank you so much, Dr. Antti.
This is for all you in India. We don't give up.
Thank you. Thank you, sir. Thank you.
Thank you
It was
so
an
much.
interesting experience. Yeah.
Thank
Keep
you.
going.